Good evening, everyone, and thank you for joining the Oxford University Italian Society. This evening, we have the honor to host surgical oncologist and assistant professor Gaya Spolverato. Good evening, Professor Spolverato.
Good evening.
Gaya Spolverato is a surgical oncologist and an assistant professor at the University of Padua in Italy. She obtained an MD from the University of Padua and she specialized in general surgery at the University of Verona. She was a research fellow in surgical oncology at the Johns Hopkins University and clinical fellow in surgical oncology at the Memorial Sloan Kettering Cancer Center in New York. When she's not researching, teaching, or operating in the OR, Gaya advocates in favor of women surgeons. She's co-founder and president of Women in Surgery Italia. This evening, Professor Spolverato will deliver a speech on her life and career. Then we will have 10-15 minutes of questions by our committee, followed by questions from you, the audience. So please feel free to leave your questions below, and I will be very happy to read them out loud. Professor Spolverato, the stage is yours. You may begin.
Thank you, everybody. It's a great pleasure for me to be here today and to share with you my experience in surgery and I'd say in advocacy and in life. You did a great presentation. I'm a surgeon, I'm a doctor, I'm a mom, I'm a wife, and I'm a friend. I'm the president of Women in Surgery Italia, but mostly I'm the person who wants to share with you my experience. And I'm very happy to be here today because I'm sure that having some role modeling will help everybody to just like come up with what they really want to do and share their dreams and start going forward. I don't really have much to add about my experience and my life as a surgeon. It's true that I'm a surgical oncologist. I specialize in surgical oncology. I treat cancer patients mostly. And I think it's a great privilege to have these type of patients that are really, really, really eager for help. And I think that the most part of it is not just to perform surgery, but taking care of patients. I'm pleased to be professor of surgery at the University of Padua. I'm a researcher at the University of Padua right now, and I am very happy to be part of this great network, which remain a very important network in Italy, in Europe, and in the world. I'm part of the Italian Society of Surgical Oncologists, but what made me honor the most is the fact that a few years ago, 6 years ago, I founded Women in Surgery Italia with Dr. Frigerio. Dr. Frigerio became a great friend of mine, and we had the chance to increase our network and to be referral figures for those who really, really wants to perform, to be in surgery or to become surgeons, or also just to be doctor and to be doctor in the way they really want to be. So please feel free to leave any question, and I will make sure to give you my email address so you will also have the possibility to reach out to me later after this evening.
Thank you so much, Professor Spolverato, and I think everybody's very happy to see you here today, and we are very thankful you accept our invitation for this interview. As first question, I want to go more in deep about your experience as a surgeon and as a resident and trainee in Italy, and then maybe we can talk more about experience in the US. My first question is about, in general, residency in surgical specialties in Italy, and how the access to surgical training can be different, between female and male doctors, and if you see that there is still some difference in the way you can access the training, but also progress once you are in the program, how you progress, and from a first year resident in surgery you become an actual independent, fully trained surgeon. Do you see that there is any discrepancies in the way, for example, female and male trainees are treated or have opportunities in Italy at the moment?
Yeah, it's a quite complex question because it summarizes what is the training, which is a problem right now in Italy for some reason, but it's also this is also something that we're working on. So I really want to answer you starting from my point of view, and first from my experience. So I graduated from med school at the University of Padua, which I think is one of the most important universities. And I think that the training we got in med school was great. I don't want to spend time saying that we have to have the medical students to practice medicine before ending the med school, because this is something that everybody says, that we really have to have the medical students in the clinic to have them being part of the network. But I don't really think that this is the point. If you have a great training in med school, this is something that nobody will take away from you. So I think that med school is the most important part of the training, even before residency, even before thinking about surgery. So you have to make the most of those 6 years. After med school, I decided to start my residency here, even if I had the chance to go to the US before, because I was finishing med school and I was done with my exams, my tests in January, and I could graduate in July. So I had like almost 6 months, like six months to work on my my thesis. And so I decided to go to New York, and I was accepted as a med student there. That training, that time was great because I had the chance to see the world. I had the chance to see how other people do things, but I also had the chance to understand that I fit well where I am. So I went back, I started residency. And after 2 years of residency at the University of Padua, I decided that I really want to go back to the US. So during my second year residency, I studied for the USMLE and I got my license, and I was able to go to Johns Hopkins, as you said before, for research. I stayed there for 18 months, which is a great opportunity, another great opportunity that the university in Italy allow you. So after 18 months there, I came back to not to the University of Padua, but I came back to the University of Verona, where I had a special training on pancreatic surgery and on pancreatic cancer, of course. After that, I decided that I really, really want to continue my training because I felt that I was not good enough in surgery. I had a strong knowledge base, but I didn't really have that much hands-on experience, even if at the University of Verona I had a great surgical experience. So I decided to go back, and I was very happy to got into the International Fellowship of Memorial Sloan Kettering, where I had like an enormous exposure, and I had the great time in surgeon the OR and in that great environment. So why was my career, my 6 year of residency so different than everybody else? Because I really want to make my own path, which is something that is possible here. So you have the chance to start in a place, and if you're not happy with that place, you can move. You can go somewhere else. This is something that our country allow you to, which is very, very important. But on the other hand, why I really needed to go away? So I really need to go away because I really need to have hands-on experience, which is something that is very, very common in the US, but is not here. It's becoming more and more common, but we are still facing a lot of difficulties. We are still facing situation where you have just the old surgeons performing surgery and all the others watching, which is something that has to change because times change, and we really need to adapt to these differences. So I didn't really want to make it a women male thing because it's for all our residents. And I feel it and I see it because I'm working at a university hospital and I have my residents. so I'm really trying to change this, and working now in the residency at the University of Padua, we are really trying to change things, to try to see if by joining, by matching one resident to a mentor, we are improving the training. And this is something that might help, but I'm just trying, as I just started last year. So I'm still on my pilot trial. But I'm sure I'll let you know. Regarding the gender issue, so we just we're just working on a paper that was actually submitted a few weeks ago. That came out of a survey that we did as Women in Surgery, to assess the training and the differences in the activity of women surgeons compared to male surgeons. We had over 3,000 responders, and we saw that women in general are satisfied with their profession. Women surgeons are satisfied with their amount of work, with their, they have a lot of satisfaction from what they do, which is very important. But on the other hand, they are not happy with their work-life balance. We're going to get there. Beside that, women are burdened by childcare duties, housekeeping duties, and all other things that make them less available to stay in the hospital longer, even after the day finish, to do some research or to do something else. Regarding the way they are treated, I feel like most of them, at least from their answers, most of them feel that there are some kind of, I don't know, microaggression or gender differences that happen on a daily basis. And these sometimes translate on a different way you stay at work, and you're different. You feel the environment a little bit more difficult, more against you compared to male. But I don't think that these translate in a difference in training. I don't think so. But I still think that there are some biases in these answers, because of course people are worried to say things. People are really worried to say, hey, listen, you're not training me as you're training my male counterpart. You know what I mean? So it's quite difficult to have clean data on this, but at least this is my feeling. So we are not training male and female differently, but we should train them better.
Thank you so much for your extensive answer. And so our next question is a bit connected to what we have been saying. So other than hands-on experiences, so you have experience in both the US and Italy. And so other than hands-on experiences, what do you think are the main differences in the way women experience their medical school and then residency?
So I always say that the way things go in the US are quite along a path. Like you have a path, you have your med school, and then you do residency. And to go from 1 year to the second year, you have to have performed X surgeries, etc. This doesn't happen in Italy. This doesn't happen. This depends on the place you are, on the mentor you have, on the person you are, on how much you really want to engage yourself to surgery. And this is not just for surgery itself, like just to perform surgeries, but also for your ability to do some research, your ability to speak at meetings, etc. So basically, I think that the path in the US is much more predictable than here. In the US, you have 5 year of residency, and if you take years off for research, they are just here on a side. And basically, you need to perform an amount of surgeries to be a surgeon. Here is different. Is quite different. And regarding the way people are treated, I don't see that many differences. So I don't think that male and female are treated differently, comparing US and here. I feel just it depends on people. It depends on the place you work. And you always say, I had a great experience in the US, but I stay in like top level centers. I don't really know what happened in the middle of nowhere. You know what I mean? So I don't really know why in Italy. Well, in Italy, I know I kind of know what happened like in the big cities, in the big academic center, and also in the small town, because I had the opportunity to hear a lot about women and other surgeons that works in different scenarios here in Italy. Well, I don't really know the scenarios in the US except for the top-notch center. You know what I mean?
Oh, makes total sense. Obviously, it's different from the middle of nowhere in Indiana,
Yeah.
compared to the New York
Right,
City.
right.
But so, change a little bit the topic of the discussion. I want to talk more about your research experience and the research you do, because as you said, you are a researcher today. You did research in the US, you do research here in Italy, and you even mentioned that you do research with women in surgery in your university, looking, for example, at disparities to access. So you mentioned a survey that you're doing that actually, I think, many people probably that are listening to this maybe participated in the survey because it was everywhere on social media and in LinkedIn, etc. I feel personally the research for me and to me was very important. It really helped me, progressing in my career, and now it's something I really enjoy. What I wanted to ask you is why you started doing research in first place. Was it just to access United States more easily, like some people do, or you wanted to try something different? And then the second part of the question is, do you still like to do research? And if so, there are many people that are young, maybe listening to us, and they're students, residents. Why you would recommend doing research to a young doctor, a young researcher, or a young resident?
Listen, I do love doing research. I think I would never be a good surgeon if I weren't good at research. You know what I mean? So I really feel that to be a good surgical oncologist, to be a good surgeon, to be a good doctor, you had to study. You can't rely only on what you got from med school. I told you, what you got in med school is like the rock, is the basis where you build your knowledge. You know what I mean? So basically, I think that the more you study, the more you go deep in what your like clinical hypothesis, or the time you spend studying or focusing on every single thing that you see in the clinical practice is the time that build your knowledge. So I do research. I study a lot. I really like studying, but I do research, and somebody is to make jokes say that I can do research on anything, and then it's true. I mean, I really want to know a lot of things, so I do a lot of research, and I mostly do surgical oncology research, mostly clinical research, but we also have a lab here, and I was happy because a few years ago I did summer class, an Oxford summer class here at the University of Padua, and I gave a lecture on organoids, which is like something very different we were discussing now. But yeah, I do translational research, but mostly clinical research, and I also use research to assess gender gap and then all the gender differences that we are facing, to measure them. Why did I do research in the first place? I think that I did the research because I really wanted to learn something that nobody would have taken away from me. So it's true that I did at the first couple of years in residency, I didn't really have a lot of exposures in the OR. I was taking care of the floor. I was seeing some patient in the outpatient clinics. I was like helping some medium cases, but I was not that involved in the OR. So I said, what I can do, except for living, what I can do. So I went to a conference. I met Tim Pollock, who became my mentor, like my very first mentor. And he was giving a talk on mentorship. And he was giving a talk on find the right mentor. And it was like quite a few years ago. It was like 9 and 10 years ago. And at that time, nobody really was saying anything about mentorship or mentors or role modeling. And so I heard him saying that it's really important to find a good mentor, that it's really important to be available for your mentor, to be good enough to have a mentor, like looking for somebody like you. So at the end of the talk, I said, I went back to the podium and I said, listen, I really want to be your mentee. I was like, why you? I was like, I'm like just a resident. I'm in second year and I'm from University of Padua. And he said, well, what are you going to do in the next year or 2 years? I was like, I don't know. I'm maybe more residency. I said, no, you're coming to the US. And at that time, I decided to go and then work for him. So I worked for him for a year, and then he asked me to stay longer. And I actually applied for residency there because I really want to stay. But I didn't even go. I didn't even go through the match because at one point I said I had like 9 or 10 interviews, which was like a lot for an international. But I said, listen, I'm not staying. And he was like so surprised. But he was happy for me. And at that time, he was a great mentor. So he taught me everything I needed to know about the research, and he let me go. So I went back and we kept working together, and we're still working together. He just emailed me a couple of hours ago asking me for like some analysis, etc. So yeah, you have to find a partner in crime. You have to find somebody who really wants to work with you, to do research with you, and when the time passes, you have to be that person for somebody else. So now I'm teaching somebody here. I have a really, really, really great mentee, who is Julia. Thank you, Julia. and yeah, so you have to keep things going. And I'm always very happy to help people to achieve what they really want, and also to answer to their clinical questions or any research questions.
Thank you so much for this inspiring story. Although obviously, let's move on a bit from the medicine related side and research, just because I don't understand anything of it. So I'm obviously a woman, and I'm interested in your role in advocating for women in academia and women in STEM especially. So what do you think of the political choices that the EU and Italy have made for women in STEM so far? And do you see a change? And if yes, what you think made the major changes?
So I think that we're moving slowly, but we are moving, which is great. I think that we have been talking about STEM a lot, and we are, and we finally realized that we don't have to talk about STEM at the university level. We have to start talking about STEM with babies, with kids at kindergarten, at I don't know, like elementary school. So I really think that we are in the right path. And I was looking at the data from the University of Padua. We're really working on helping women to find their path and to be confident that they can definitely work in STEM, to have a STEM career. For example, at the University of Padua, we are working on a mentor-mentee program. We are going to different schools to to increase the awareness about the stereotypes and the unconscious biases. So while you really go back to kids and you go in the school and show some role models, as you did before, when you tell people that they can do it because here there is somebody who did it, so you are helping the next generations. So I don't really want to focus on what we are doing uh, to help women in leadership position, which I think is great, which I think is really needed, mostly in STEM. But I want to make you think about what we all can do about girls, about young boys. And this is what we all need to do because we all are responsible for what is happening. And I remember once a few years ago, I went to a school and they were like, I don't know, like fifth grade or something like this. And they were, hey, listen, they asked me. So I couldn't say what was my job. And they're like, hey, listen, what's your job? I think you're a hairdresser. Like, no. Because I was telling them I use scissors. Like, oh, you're a hairdresser. I'm not a hairdresser. Then so it was quite impressive because none of them thought I was a doctor, and of course none of them thought I was a surgeon. So I started asking them, what do you think a surgeon look like? And they're like, oh, first of all, he's old. He's bald and he's a male. I was like, no, you're kind of better than this. So you have to go back to the kids. Yeah, I definitely think that we have to teach our kids. I have to teach my my young boy that anybody can do any job, and so we're gonna open more room for women in STEM.
Hopefully, if I want to be a surgeon, I can keep my hair. But other than that, I think this was very interesting. And actually very true, because I assume most kids in the school would do the same everywhere in Italy and probably in Europe as well.
Yeah.
So the next question is more on the cultural side of experience in different countries, and this comes because I started my training in Italy, but I've been in the UK, and now I live mostly in the US. So I experience working with people in medicine, but that come from totally different country, totally different experience. And one thing that I experienced is that when I was in Italy, most of the time, when something was wrong, there was a lot of complaining about it, and I was guilty of that myself. But when I went to UK and even more in the US, they were living peaceful life, especially first year residents, intern year, all that stuff, and they do 100 hours per week. They are miserable. I never heard anyone ever complain about it. They were like kissing on the floor, that they were in residency, that they're doing what they love. And this was to me astonishing, and made me realize that I was complaining all the time about the most dumbest stuff ever. So I wonder if you had a similar experience, and if you explained it just because of a cultural difference, or maybe the way we approach problems in general.
Yeah, I'm sure that it's a cultural thing. I can hear my residents saying that they work too much, they have too many night shifts in a row, and I'm like, you don't really know what you're talking about. So, but I don't want to be too bossy, and I don't want to be arrogant. But yeah, it's a cultural thing. The fact that here nobody is gonna kick you out from the residency. Nobody is gonna kick you out from med school. Nobody is kicking you out from anywhere. And remember that this is a public system. Even the healthcare system is public, which I think is one of the best achievements of human being. But I think that on the other side, the fact that you can complain, and I guess that nobody's going to tell you anything about that. So this is completely different in Europe, in some place in Europe, but it's totally different in the US, where, as you said before, you have to work a lot. because the more you work, the more you're going to achieve. So why Italians do this? So why some Italians do this here? I think that one of the reasons is that mostly in some field, and I think medicine is one of them, there's not a linear correlation between how much you work and the effect that you get and the result that you get. So this is frustrating. So in a long run, this is very frustrating. So I can see it. I can hear people saying, "Listen, you can't act as you were in the US because you are not in the US anymore, and the US are so far from here. But I want to keep my enthusiasm, and when I lose my enthusiasm, I go back to the US." Because you can't stay here. You can't work with people who really need you if you're not enthusiastic about what you're doing. So, and I'm not saying that here we have like great doctor, but the best doctor I met here are those who didn't lose their enthusiasm. Where they keep going. They keep going against a lot of things and against a lot of rules, but they keep going. And I feel that this is something that makes us stronger, even compared to other doctors in the other part of the world, but makes your life like miserable sometimes. And so we are Italian, so we keep complaining, but we keep working. You know what I mean?
Yeah. Thank you so much for your answer. And let's move on to our next question. We often hear that the Italian system and our government does not do enough to keep its talent, But what can individuals do, and what can young people especially do to make the situation better? Like we have an audience of Italians abroad. So what can we do?
So I think that having an experience abroad is something that is very important for your career and your life in general. At one point, as you all know, you have to decide if you want to stay or you want to go. If you want to go back to where you come from or start a new life or keep doing what you're doing. So this is something that is quite heavy for everybody. I remember that for me, like deciding to come back to Italy was very difficult, even the last time I came back. Because of course, as I told you, I mean, in the US, if you work a lot, you get a lot. So why somebody has to come back? And what can our country do to help us to stay, or at least to come back? I think that one of the most important things that the University of Padua has done recently is to hire people who got high research record or won ERC grants, etc. So those type of people were had the chance to come back to the University of Padua as assistant professor or associate professor. So there is some kind of awareness that we are losing people. We are losing good scientists. So for this reason, we have to come up with some way to have those people coming back at least after a good experience, at least after a very deep experience on their field. So what can we do? So what can we do as a doctor and as I'm a professor here at the University of Padua? I can reach out to people, but I also can make sure that people know that here we can do good research. We can be very good on our specific field and be open to accept people from abroad, helping them to get a good position at the university. I think that the universities are the place that have to invest more to get the people back, to get the really, really good Italians who left and really want to come back, having a good positions here in Italy. I can be open to accept new people. I can be open to help people to go and to come back, as all the professors should do. And you should reach out to a mentor. You should find somebody who inspires you. You should find somebody who really wants to share his experience with you and help you to get your place in the world. Because that time you guys are spending thinking, what I'm doing, should I go back? Should I stay? Is the time you need to share with somebody else, because it's a very difficult decision to make. And you have to find not just like your family helping you, but you have to find somebody in the field opening your eyes. Because it is true that there are so many pitfalls in our system, but it's also true that the system is very, very adaptable, and you can find your way. You can find your path. I always say that if I was able to come back, anybody can come back, because it's true that it's difficult. It's true that you have to face different difficulties compared to the US, where you basically have to work a lot, and this is what you have to do, and that's it. Here there are many difficulties that you can't really think of, but being home, I mean, is and being able to change things from this side of the ocean, I mean, it's quite interesting. It's cool. So you can make the difference.
I think it's very cool, and I'm sure that all the people listening to this are getting excited about it. Now they want to change a word, which is a good thing. Changing totally the topic, I know when we invite people like you that are somehow at the top of their career, and people look at our guests like their idols or gods and so on. We also like to ask some questions more on the human side, just to make it more real, right?
Yep.
And one thing we wanted to ask you is, you lived I think 2 years in New York City for your fellowship. And obviously New York City is another place that many people dream of. What is, if you want to tell us, one story or one memory that you remember of the time you were living there, something that you really liked about the people or the city or anything else?
I would say that New York is fantastic. I lived 2 years in Baltimore before, and it was not quite the same. So New York is fantastic for everything you already know. I don't really have to tell you how great it is, how inspiring is the environment, how many people you get to know, and how many stories you can share with different people coming from all parts of the world. So this is the best part of it. So I have different stories. When I first listened to your question, I thought, hey, maybe the best part of it was going out for a drink with my colleagues after 12-hour shift, 14-hour shift, or 11 hours in the OR. You know what I mean? But on the other side, I think that the very best time I had was running. I do love running, which makes me more crazy because I run at 5 in the morning. But in the US, I couldn't run at 5 in the morning because at 6 we usually go to see patients. So I had to run at 4 in the morning, which made me even more crazy. So the fact that with a couple of friends of me, we every other morning we're going running, in Central Park at 4 in the morning was one of the most like the best experience I had in New York, because you see the city when everybody's sleeping. There is no tourist. It's just like you and the city, which is impressive. And regarding Memorial is a great place. I talk with everybody, so I end up talking with, I don't know, random people at the cafeteria and asking for their story, their life, and this is what makes New York like a great place, because you get into a very, very different environment with people coming from all over the world, and sharing stories and knowing about their lives, and know how alone some people are in big, big cities. Make you feel how happy and how fortunate you are and how lucky you are to have a home and a place where you can go anytime, which makes Italy a place, a better place to live compared to huge cities.
So I have to admit I cannot relate to the passion for running, but
And neither to wake up at 4 in the morning, I guess.
I'm an early bird. I like to wake up early in the morning, although not at 4, I have to admit. Um, but I think we can both relate to the experience of, living abroad and missing home, and then going back home and missing living abroad. So, when you were living in the States, what were the things you missed the most about home? And now that you're back in Italy, what things do you miss the most about the States?
So this brings me back to the night I couldn't sleep because I had to think if it was the right choice to come back or to leave. It was always very easy for me to leave, to go back to the US, because I knew the opportunity I could have. It was very difficult to come back because for some reason, we are all allowed to think that you can go abroad for work, you can move for work, but you can't really move for real life. I don't know if you understand what I'm talking about. So we are all allowed to leave and then to sacrifice for a better job, for a better position, for more work, more money. But it's very tricky to decide to come back for your own life, for your own family, for your own passion, for your own gut. You know what I mean? So what I missed the most when I was in New York was when I was in Baltimore mostly, was my family, was my brothers, was my parents, was my grandma, was my husband. It was tough. I really missed my people. And being a doctor, I really miss taking care of my people, the people who come from this small place where I was born. I really miss taking care or even talk with the people, I don't know, at the bakery shop. I really miss my own people, which I think made me to finally decide to come back. So I miss the people. I miss home. I mean, I miss home so much. Even if work was great and I had many friends and my husband was coming back and forth, etc. I decided that I really want to go back. And I decided that I want to have a family and that the best place to have a family was home compared to the US. Because I saw a lot of friends of mine, a lot of surgeons struggling with young kids and not having their family or like their parents next to them, and not having anybody helping them with the kids, and having to rely on a bunch of nannies and kindergarten, etc. So I thought, I don't want my life being like this. I don't want like the life of my son being like this. At least not the first 10 years of his life. Then when I'm here, right now, I miss the organization. I miss the schedule. I miss knowing exactly what I'm going to do today. Knowing that it's 5 a.m. I'm waking up. I'm going to the hospital. At 6 I have round. At 7 I have conference. At 8, 5 OR. It ends at 7 p.m. I see patients. I go home, and that's it. Here, every day is different day. Every day you have something more. Every day you're supposed to go to the R, and then for some reason the R doesn't start, and then you have to go to conference out. Or can you go there for me, or can you do this, or you want to talk at this meeting instead of me? It's like tomorrow the meeting. Yeah, well, you can do it. You know what I mean? Like this doesn't happen in the US. I mean, you know exactly what your schedule is gonna be, and this helps to organize a little bit your extra time, which you don't have a lot, but at least you work a lot, but you work in an organized fashion. Here is much more, I don't even know a word, but it's much more, I don't know. It's different. Here is just different.
It's always a surprise.
You all know what I'm talking about.
Every day is a surprise.
Yeah, exactly.
It's fun. It's a lot of fun. So I want to go back instead to another topic we touched earlier, which was research. And you mentioned, and we talk a little bit about the work you do with surveys and with women in surgery. And one thing that I learned very quickly in the US is that medical doctors and in general researchers here really work very hard with research for advocacy reason. They want evidence to fight for what they think it's important, to fight for change. And I think that that's something that we don't do much in Italy. And I was actually very glad to see that you and the women in surgery and other people are starting to do this in our country.
Yeah.
Do you feel, based on your recent experience, because I understand that you started recently doing this, but do you think that is research empowering you when you come to talk with leadership, when you have to talk with the institution and so on to make change happen?
Yeah, the power is in the numbers. I always say that. In the number of people working on something, in the number of people advocating for something, in the number of people answering a survey. So the power is in the number. I had the chance to talk with very relevant people, with politicians, about women and about women in medicine. And they all want to know, who do you have behind you? How many people are you representing? Well, give us some numbers. So you really need numbers. And I learned this from cancer medicine, from oncology, from surgery. You need to have evidences to do something. And I don't really want to spend my time in a podium saying, hey, it's very unlikely for women to get what they want, or like without giving numbers. So let's say something. For example, in general, the number of professors of surgery in Italy are 2% of the total, which means that 98% are male. Do you think that's something that shouldn't be said? Or, for example, most of the women that are director of a surgery department are just director of a small unit, not a big complex unit, because a big complex unit are run just by men, except for 2 in Italy. Yes. This is something that somebody has to say. There are some board of the Society of Surgery in different disciplines that are all male. How can you represent the rest of the board? How can you know what female surgeons or female doctor, or in general female face every day. So we have to give people numbers, otherwise they don't trust us.
Thank you so much, Professor Spolverato, and thank you so much for raising these issues. And I'm sure our audience will make a treasure of what you said, and will just try and work for just women in STEM in general, and women in surgery, what you're doing with your association. And thank you very much for answering the questions from me, Emanuele, and the rest of our committee. And now it's time for some questions from our audience. So please feel free to leave a comment on this video and I will read them out loud. So we have a question from Cecilia. Thank you so much, Dr. Spolverato, for the interesting discussion. I was wondering whether you could discuss the implications of rising antimicrobial resistance on your work. Is the threat of AMR taken seriously enough? As a healthcare professional, what would you want policymakers to do about it?
I didn't expect that specific question. But I have a question. I have an answer for that. So recently, we ran a study on antimicrobial resistance in the era of COVID. And we saw that with the new DPI measures that we have to use for the COVID, even after major surgery, we face an important decrease in the number of antimicrobial resistant infection, which make me think that there are many more paths to explore to improve our awareness of infection in general. This runs for COVID. This runs for infection in the hospital. So why are you so interested in that? Are you doing some research on that? Can we answer back? Can we ask some question back?
I don't know. I think she can write.
Let's see if she writes something.
She probably escaped. She left the room. While Cecilia thinks about it, I have another question that is always, on something you mentioned earlier, which is about coming back to Italy after an experience abroad, after some training abroad. One thing I noticed is that when I met in my life people that in the medical field that had some experience at some point abroad, and then they came back, I always saw that they have a totally different approach to everyday work, to students, to trainees. I mean, this is true even for any people that in general travels a lot versus people that stay always in the same place. But I feel like in the work, if you go away for training and you live a long time, that's even more. Did you had the same experience? And obviously you are one of them, so probably this is a kind of bias, but I'm sure other people in your same field or other fields that did this. Did you experience the same? And what do you think about this? Like, is it something beneficial to their career after, and to the system in general?
Yeah, going back. So bringing back experience is always good. Diversity is always good. Contaminate with different ideas, with different, with the knowledge you got from a different environment is always beneficial. So I can tell who traveled a lot and who didn't. And I can tell in the position they got in their career, in the way they work, in the way they talk with people. in the way they treat people, because if you travel a lot, you kind of know better how to treat people. You kind of know better that you can leave your barrier away. You can leave the barrier aside. The people, I got great conversation with my med students, because I don't feel that if they are young, they can teach me something. And this is something very American or very European and not that Italian. So yeah, I think that bringing somebody back is great for the person, if the person wants to go back, and for the system. So yeah.
It's great. Thank you.
I don't see any response from
Okay. Do you have another question?
So at the moment we don't have any extra question from the audience. So maybe we can wait a couple of minutes, see if Cecilia comes back to us, or otherwise we just can just come to an end. Well, at the moment we just have people saying thank you.
Okay.
They're thanking you for your speech and they're congratulating you on your career. So this is what we're getting at the moment.
I congratulate with you for being part of this great society, and I really want to come to visit you once, and so we are definitely to make up to organize something together, and feel free to email me if you really need anything from me. So my email. I'm sure that Emanuela and Julia can share it with everybody, but it's of course the email from the university. So it's my name dot my last name at UNIPD@IT. So dot IT. So it's easy. You can reach out to me.
Be ready to receive like thousands of emails this weekend.
Fine. It's fine.
But thank you so much for doing it. That's great. It's a great opportunity for all the people that listen to this. And we thank you also for all your time. I think this has been great.
Okay.
I think we can come to an end of our interview and event. So thank you so much again, Professor Spolverato, for your interesting speech and for answering our questions. And I hope that soon we will be able to invite you to Oxford and have a person maybe. But until then, thank you very much, and we wish you a very pleasant rest of the evening or morning or
evening. Was.
Thank you, and I would like to say thanks to the following people as well who have helped me organize this event. I would obviously like to say thanks to Emanuele, our secretary, and I would like to say thanks to Alessandro, our treasurer. I would also like to say thank you to our press officers, Eric, Tamara, Cecilia, and Alexandra. And finally, I would like to thank you all for joining us this evening, and I hope to see you all for our next event. And thank you very much, and everyone have a good evening.
Thank you.
Bye.
Bye.